Alright, hello there. So it's been 2 weeks, or actually 15 days, since I did my spinal fusion PLIF operation on my L5S1. Uh, the first 6-7 days were really tough for me. I mean, I slept a lot actually, like the first maybe 8 or 9 days, I probably slept 80% of the time. I think it's the oxycodone who made me very sleepy. Oxycodone and the muscle relaxer. Uh, right now I feel really, I mean, I'm not 100% good, but I feel much better than the first 10 days after the operation. So there's still no bending, no lifting, and no twisting. I think bending, I kind of got it because previous to the operation, I was always careful not to pick up with my back, mostly like pick up, by kneeling down and picking up stuff. So that one is kind of easy. Plus, I wear the belt, so that kind of reminds me. But the twisting is kind of tricky, so I try very hard not to twist because I'm kind of used to reaching out something on the left or right to pick up something. And lifting, I'm not supposed to lift anything heavier than milk, let's say like a gallon of milk, which is not really hard. There's I don't know, I'm just like avoiding that right now. I'm able to walk by myself without a cane or a walker, and yesterday I was able to go out 3 times outside and walk 30 to 40 minutes each time. So probably over an hour walking. Walking definitely really helps, and it's really good to do. Um, Lying down in bed, especially on my back, gives me nerve pain. I was actually very scared a few days ago when, because after like 7 or 8 days, my nerve pain came back, the sciatica nerve pain on the left side, which is the reason why I did this operation. The reason why I did this operation is that I had no pain when I would walk. Standing was okay, but if I sit for more than 30 minutes, I would have sciatica pain on my left side, starting from the lower back, going all the way down to my knee, like the back part of my leg. And after like 7 or 8 days, I guess when all the medication wore off, after sitting for more than 20 minutes, I felt that pain again. Also, when lying down on my back, even though I was putting, a pillow under my knees, I would still feel that nerve pain, maybe because I was lying down for a long time. So I kind of got into a very depressed mode when I was thinking, oh, maybe this operation, maybe it's a different part of my body that is causing this nerve pain. Maybe I just wasted my time. I called my doctor and I spoke to my physical therapist about it, and they actually told me that it's normal to experience sciatica type of pain or like a nerve pain even after the operation because the nerve inside has been, there is certain damage or the pressure release, and after the operation also they move these nerves around. So it's kind of normal to experience this even few months after the operation. So I mean, for me it's okay, I can wait for a few months, it's not a problem. The pain is not unbearable, but it's just like super irritating. And like previous to the operation, the pain was not requiring me to take heavy pain medications, but I would constantly avoid sitting on the left side. I would mostly try to sit on my kind of like on the right butt cheek, uh, to kind of avoid sitting on that side, and it was just really uncomfortable. Driving was very uncomfortable, irritating, and it was just like driving me crazy. Yeah, so what I do right now is, I eat 3 times a day, and right after eating, because I don't want to lie down on the bed, and I try not to sit more than 20 minutes. So usually I will eat for, I'm eating a meal, takes me 20 minutes to eat it, and right after that I'll go for a walk. You know, 30-40 minutes I'll walk outside. Today I'm not going to be able to walk because it snowed heavy yesterday, so it's risky. And they told me do not sleep. If you slip and fall, that could be very very bad for your situation, for your back. So I guess I'm just gonna stay home and walk around in the apartment. Uh, so yeah, after eating, I will walk for 30 to 40 minutes. Then I spend 10 to 15 minutes of doing some light exercises that were given by my physical therapist. These are mostly these are not like very demanding exercises, but are kind of good for stretching. And the rest of the time, I'm lying down in the bed, and I try to shift every hour, from being on my back to being on the sides. Even though I spend most of my, maybe as far as I know, I used to sleep on my stomach, but now I'm not allowed to do that, and somehow I managed to get in the habit of sleeping on the side or sleeping on the back, mostly sleeping on the side, whether it's on the left side or right side. One thing I was told to is to put a pillow between my knees when I'm sleeping on the side, or put a pillow under my knees when I'm lying down on my back, and it kind of helps, especially on the side. Having a pillow between the legs when you sleep is very good. And I actually did a research, and for centuries, the best pose for humans and even mammals, monkeys, is sleeping on the side. So if you can get yourself to sleep on the side by putting a pillow between your knees, that's the best way to sleep. According to medical research, they realized that when we sleep for 8 hours, 7 hours, whatever time we sleep, the brain is actually kind of getting rid of its toxins. And the best pose to do that is if you're on the side. This is a maximal way of getting rid of the toxins overnight. So this is probably one of the reasons why we do need the sleep. That if we are sleep deprived, the brain does not have time to clear up the toxins. So I try. I guess when I sleep, most of the time I'm whether gonna be on the left side or right side. It's kind of difficult at the beginning to kind of remember to put that pillow, but I feel like focusing on it. By now, it just became my habit. At the same time, when I sleep, I always make sure not to twist when I turn around. So I kind of put my hands up, and I try to do it, the hips and the shoulders to turn around in the same time. So that's like really important. Twisting is very, very tricky. So I try not to do it. So that's about it. I mean, right now I'm taking Tylenol. I was given gabapentin for my nerve pain, and also calcium and vitamin D. So the calcium is for the bone growth. So they're estimating that it takes 6 to 8 weeks for the bone to fuse. I hope it does. I'm trying to eat healthy. I'm eating 2 or 3 fruits a day. Mostly fruits that contain vitamin C. I'm also eating healthy food, no junk food. Trying to have a variety of different types of food. But the physical assistant of my doctor said that most likely, no matter what you eat, there will be a fusion, but it's definitely recommended that you eat healthy. So that's about it. My checkup, my x-ray and first checkup is going to be 4 weeks from now. So I'm really happy that the next 4 weeks I mostly have to focus on BLT, which is no bending, no lifting, no twisting, eating healthy, taking my vitamins and gabapentin, and also doing my walks. The walks is definitely the best part of my day right now because I'm mostly home. So being able to walk outside for 30-40 minutes, it feels great. I'm not walking like I used to walk prior to the operation. Like I said, my pain was mostly when I was sitting. I did not have pain when I was walking. Actually, walking always gave me a relief even prior to the operation. I mean, now I'm like more walking slow pace. I'm not really having, walking fast. I'm just slowly walking, but it really makes a big difference. It's really good to be outside. Unfortunately, it is December, So I picked the worst time when it comes to walking outside because it's freezing outside. But still, I dress up very well, and I'm able to go outside. And that walk, that it's sort of an exercise, helps a lot, mentally and physically, especially. They're saying like for the way for the back, for the healing, the walk is the best thing you can do. So I also asked my physical therapist. I don't get physical therapy every week. They just come. I guess it's something that they do here in New York. They come and check on you twice a week, and they already closed the case with me, so they're not gonna be coming anymore. And probably the next physical therapy I will be given is once my fusion is complete. So maybe a month or two from now. But I was kind of concerned because I'm wearing two jackets, so I asked if that may be too heavy for me, but they said no, it's okay. So that's about it. I feel like the worst is over. For me, the worst was like the first 6 or 7 days. The pain was really bad, but luckily, just to say, for the first 6 days, when I was just sitting, lying down on my side or lying down on my back, I didn't have a crazy pain. It wasn't that bad. It was only painful when I would turn, when I would try to turn, because that's when I would activate my back muscles, and that's when I would feel the pain. But otherwise, like most of the time, it's not like I was in constant pain. The first day, actually waking up after the operation, I had no pain, and I thought, oh, this is easy. But then it came in at the night, and then the next 4 or 5 days, every time I would turn, I would feel a sharp pain. Also, at that time, walking, I would feel like I have two knives stuck in my back. So it's not unbearable pain, it's just super irritating and, of course, painful. Right now, I still have some pain. Like right now, for example, I have a feeling that somebody is just grabbing my spine. So it's uncomfortable, but it's doable. I don't need for now, I stopped taking Oxycontin. The problem with Oxycontin is that it gives me terrible constipation. So I had to stop it for a few days, and I'm taking fiber supplements every day to help have a bowel movement. Eating lots of soups definitely helps. Yeah, so that's about it. I guess the next video I will make will be a month from now, when after visiting my doctor to see how things are going. For now, the next 4 weeks, the plan is, like I said, I only sit 20 minutes 3 times a day after I eat. I walk right after, I go for a 30-40 minutes walk after eating, and the rest is just being in bed and just taking it easy. And hopefully the fusion will be complete in 4 or 5 weeks from now. Take care.